Okay, we're live.
Morning, everybody. Welcome to the Health and Social Care Scrutiny Committee. We have got a full agenda today, so I'm going to crack right onto it. First item is apologies, please, Wyn.
A couple of apologies, Chair, from County Councillors Gareth Radcliffe, Edwin Roderick, Gareth Morgan, Josie Ewing.
Thank you. And anyone got any declarations of interest? Anyone connected to anyone in any of the workforces or anything to declare? Nope, can't see anything. Disclosure of party whips. Anyone a whip for their party? Nope. Okay, minutes from the previous meeting. I'm assuming you've all had a chance to read these. We have got is the 2 minutes, Wyn?
Yes, there should be.
There's one from back in July. I thought we'd already approved these.
That's right, July and October, Chair.
July and October, yep. So we've got those two. Has anyone got anything to raise on either of those? No, I think particularly the October ones, those minutes show it was a really good scrutiny meeting. We came up with lots of recommendations, so I'm pleased with how that looks. Can I have do we need to take them each in turn, Wyn? Or can I do them both together?
You could do them both together, Chair.
Can I have a proposer for those minutes, please?
I'll happily propose them.
Oh, was that Glyn?
No, sorry, it was Ben.
Ben, I've got a proposer for Ben. Chris, you've got a hand up. Are you happy to second?
Yeah.
Thanks both. Okay, those are passed. Okay, so now on to the first main item. We're on to the Q2 performance report, and we are focusing on the adults and children's section of this. I would like to welcome the leader, Councillor James Gibson-Watt, to committee this morning as the report is in his name. And Councillor James, I believe you're just going to introduce the report quickly, and then we'll hand over to officers just to take us through a brief overview of it before we go on to questioning. Morning, James.
Good morning, and thanks very much for allowing me to speak, Chair. I just wanted to say I'm pleased to be here, and also to say that this report, it's not that easy to find your way around unless you know what you're doing. I'm sure you would agree, and that's why with your permission, I would invite the officers in particular to deal with most of it, but happy to answer the questions. Despite expert tutoring by Catherine James and others, that I still find it difficult finding my way around the PBI system, and so I'm very understandable when members are confused or have some questions about defining things and so on. So hopefully we can clear all that up today if there's anything that's not clear. So thanks very much indeed, and happy to answer any questions as and when. Thank you. Thanks,
James. So what I would quite like is for Lynette or and Nina in turn, or whoever's appropriate, maybe Michael Gray, just to give us the high level headlines really that you think that are the ones that are most pertinent for us to be aware of as committee. So I think starting with starting in the report, it starts with adults, I think, is it? No, I'll start with children because I realised that some officers weren't sure who was leading on this. So I'll start with Lynette, please, if that's okay.
Yeah, thank you, Councillor Jenner, and we're pleased to come to the scrutiny today with the performance report of Q2. Since the Q1, we have a new interim head of service, Sharon Powell, who's with us today, and she will give the overview, the headlines of the Q2 performance report, which you've all seen and obviously got questions for. We will just give a high level now report on some of the headlines of the performance before we go into questions. So if it's okay with you, Chair, I will hand over to the interim head of Children's Services, Sharon Powell, just to give you that brief overview of the performance at Q2 for Children's Services.
Thank you. Over to you then, Sharon.
Yeah, Bore da. Good morning, everybody. I'm Sharon Powell, for those of you who haven't met me previously. So as Lynette said, I came into post on the 1st of September, so right at the end of Q2. And I guess some of the highlights from that time when I came into post was really looking and taking stock of where we were at. So there's lots of strengths within our performance, although there are some complicating factors around some elements. So things like our child looked after numbers have remained very stable. We've got a clear trajectory on looking at those numbers and looking to decrease those as the time moves forward, whilst our child protection figures have kind of increased at the back end of Q1 into the beginning of Q2, and they kind of maintained that sort of trajectory over the summer. We very much took a stock of those numbers and looked at ways in which we could start to begin to think about reducing those numbers. So into Q3, though, you will see a trajectory of those child protection numbers actually decreasing. Some of the kind of really quite high level things are obviously the budget in terms of the overspend. That is mainly and largely due to increase in the cost of placements, particularly around residential provision and having the lack of affordable placements in county. So that has kind of increased our kind of budgetary area in terms of Q2. We've refocused on our closer to home strategy. So that's kind of the backbone really in terms of progression, in terms of service delivery and outcomes. So that looks at recruitment of foster carers, looks at our residential provision, it looks at bringing children closer to home. So we've realigned that child closer to home strategy and developed a board which is kind of emerging into Q3 in terms of some of the actions and aims and objectives of what we're trying to achieve around there. So in terms of staffing, we have still relied on a high reliance of agency staff into Q2, but during the autumn we have had 5 newly qualified staff through our Grow Our Own programme who've come into practice, into positions in Q3. So that's really helpful in terms of building those blocks around retaining our staff and building on our Grow Our Own progress. So the pressures really are remaining around those high cost placements. That has had an impact on our budget, but overall our kind of performance around our children looked after and child protection figures are kind of, there are plans in place to look at those numbers and to reduce those numbers going forward.
Thanks Sharon. I think we do have a few questions on the children's side of things, but before we just go on to that, Councillor Gareth Jones, you just wanted to raise a point about the structure of the report.
Yeah, thank you, Chair. Just in the performance report under section 1.2 for health and care, there are 3 objectives identified, but then when you go through the report, it picks up other objectives. You know, when you look at the ones under the, the areas that are under red, it says that 3 objectives are under red, causing concern. So that would apply to me that all 3 objectives for the services are under red. I just find it quite a difficult report to follow. It's not, in my mind, it's not that well structured. I can't see the thread going through from one section to the next section.
I know that's a bit of a sort of above,
yeah,
kind of outside of what you've just gone through, Sharon, but I thought we kind of needed to raise it at the outset before we got into some of the details. So I don't know who wants to respond to that. Is that something that maybe directors you could take back? And yeah. Sorry, Nina.
Yeah, Councillor Amanda, thank you. Thank you, Councillor Gareth, for your comments. Lynette and I can absolutely take those comments back to the team who deal with this reporting, and we'll see what we can do and come back to you if that's okay.
Yeah, I think from we've got a lot of new councillors on this committee, and there was a lot of information in here, and I appreciate that it's good for us to see the overall picture, but as a committee, it's the structure but also the volume is
Yeah, I absolutely. There's a very significant amount of information here. So we'll take that away as an action, absolutely, and we'll see what we can do. Thank you very much.
Okay, right, and we'll back onto the children's side performance. Thank you, Sharon, for that. You've mentioned about the closer to homework, and I know Councillor Liz has a question on that side of things. Councillor Liz, are you okay to ask your question now?
Yes. Thank you, Sharon. And I hope you can answer this. I appreciate that you're in post, but going back to last year, there was 1.5 million identified as savings in the closer to home placements. We're picking up that those savings have not been met. Some of them, I think, were for in-house foster care, increasing that, and some were about creating a children's home in the south. Now, I think it's become clear that is difficult, and we just wondered if you might be able to give a bit more information about what is going on to try and locate somewhere. And one of the questions that has been asked is whether or not any of the county farms might have been considered, and the pros and cons of that as an option, because clearly, you know, if the 1.5 million you know, isn't saved, then you know, gonna be added on to next year.
Yeah, thank you, Councillor. So the closer to home strategy, what we've looked at in kind of design it as a board is kind of have a much clearer focus in exactly what our objectives are and what we're trying to achieve. So one of those areas, as you've quite rightly said, is around increasing our in-house foster carers. So we're working with Foster Wales in terms of developing a strategy alongside them in terms of recruiting new foster carers within Powys. We recognise that we haven't built our grow our own strategy with our foster carers in as much depth as we would like. So our plan and progress really going forward is very much around building our in-house foster carer provision, and no doubt you will have seen some of the marketing across Powys over recent months around that, and coupled with the John Lewis advert, there's been a real drive in terms of focusing on foster carers as a whole nationally across Wales, using Foster Care Wales, but also for us internally as well. So we've come up with a new strategy in terms of looking at how we can kind of progress that kind of area around interest around foster carers, and that also works with supported lodgings hosts. You'll also be aware that we, as Powys, have unaccompanied asylum-seeking children that we are responsible as part of our Children Looked After. So again, we're looking at ways in which we can support those young people and use provision within Powys rather than have to look at provision usually what we've looked at is provision in London. So by having a different focus in terms of looking at what we can do differently, so we have got a provision in North Powys, which we've developed with a housing association called Llamau. They've been looking at properties for us. They've actually secured properties in the north and just recently secured a property in Brecon. They provide support to those young people that live in those properties. And so we've actually recently placed some of our unaccompanied children together in one of those homes in North Powys. So that hopefully will have an impact on some of those projected figures around savings and on costs. In terms of our residential provision, we have a residential provision strategy, and we have developed and are developing some residential provision within Powys. We do have children and young people placed in all of those homes that we've actually got. You'll be aware that we've got Banai, which is our provision in the south in terms of children with complex needs. That provision remains full. Some of the complicating factors around developing the residential provision is that it doesn't automatically create a saving at the start, and we are reliant on staffing to be drawn from agency settings in order to kind of provide that support to those young people that are living in the residential provision. But we are currently out to advert in terms of recruiting staff to all of our homes, and actually we've had quite a number of applicants for those positions, and we were actually holding job fairs in January where we're going out to kind of just promote the interest, promote what we're trying to do around the residential provision, to hopefully grow our own residential staff to live within those homes. On looking and reflecting on our strategy around our residential homes, you know, for me, very much coming in new into post, I wanted to press the pause button on where we've got to, because we've got a number of homes now where we've secured buildings. And for me, I really wanted to develop the qualitative approach to those settings rather than actually have the quantity of buildings, and then we're not able to actually provide our own staff to be able to provide those qualitative care plans to those young people. So there's lots of different strands kind of happening around all of what I've said in terms of the foster carers, the residential provision. In terms of the question you raised about Powers Farm, I'm not aware that we've looked at any farms particular, but that could be an area in which we could explore if that is a possibility. So I'll definitely take that forward and kind of look into that if there is an opportunity to develop something in that way or not, because that sounds like a really good opportunity when you're thinking about therapeutic intervention for children and young people living in an environment such as a farming type area. There's lots of kind of things I can see that would be of real quality in terms of looking at that. So we haven't, to my knowledge, looked at that previously, but that's definitely something that we could take forward to consider.
Thanks, Sharon. The county farms question was actually from me, and because Liz was asking a question on that, I asked her to roll it in with it. But yeah, in terms of maybe opportunities for respite as well, and if we do have properties, county farm properties, which we are not able to sell easily because of the condition they're in, but actually it might be cost effective to adapt them rather than buy new properties in terms of children's services, then I just wondered whether that had been explored, and it, it may not be appropriate, but that was my question.
Can I just ask a supplementary, Chair?
Yes, absolutely.
Yeah.
Just before you do, Liz, councillors, I can't see any hands up, so please, any questions on children's, please put your hand up. Go for it, Liz.
No, I just wondered if the number of children that are placed out of county, whether that's reduced over the last 12 months.
It hasn't reduced to the target that we've set, councillor, but it is something very much that we're looking at now as part of our kind of recruiting our in-house foster carers, because we can't bring children back, obviously, if we don't have the foster families in order to place them in. So it kind of, you have to kind of look at it, I guess, in parallel, really. We're aware of our children that are placed out of Powers. Some are placed with family members, some where family members have moved away, so you wouldn't necessarily be bringing those children back because you'd want them to remain with their families in that particular setting. But there's certainly young people that we want to bring back to Powys, but we need to develop and grow our own foster carers and provision in order to do that. So to answer the question, it hasn't lowered as much as we would have liked, but certainly that is our plan going forward.
Thank you, Rachel.
Thanks both. Sharon, on the foster care side of things, I'm aware that every year foster carers complete an annual review, and within that they do a feedback form themselves on how they've found the service in terms of support to them, and that's picked up at foster panel, and we ask questions to see, to try and ensure that they feel supported as well. But if they don't feel supported, or if they've got some ideas themselves as to how things could be better in order to encourage that we keep our foster carers, how is that picked up through a management level to ensure that that's then fed through and actioned? Is that generated into some kind of action plan from the foster carers annual reports?
So that information would go to the service manager, who's Charlie Darwin. So she would pick up on that information as themes from the panel. But I hold monthly meetings with the foster carers in terms of looking at all the strengths and weaknesses. So that has generated its action plan. In effect, they directly speak to me about their feedback and views, and then we're looking at what we can do to kind of take that forward and strengthen it. And they've actually come up with some really good ideas about campaigning and what additional support they would like to see happening. So we've kind of got that as a rolling action log as part of that sort of process.
Yeah, and I have to say, you know, compared to 5 years ago, the feedback from foster carers is completely different these days. But it's just I just wanted to make sure that's captured. Lynette, I can see you've got your hand up.
Yeah, thank you. Thank you, Chair. Yeah, I just wanted to come in on the back of that in terms of increasing the number of foster carers within Powys. This is a really important strategy for us moving forward. And I think I just wanted to mention here in Scrutiny, really, with elected members in Scrutiny, really anything that we can do to encourage foster carers within Powys moving forward would be really helpful to us going forward. So I just wanted to say that to members in here, really. It is really a main part of our strategy going forward to bring children or keep children in Powys is to increase our number of foster carers within the council. Thank you, Chair.
Thanks, Lynette. Councillor Jonathan.
Yeah, thank you, Chair. Just a very quick one on the back of that from Lynette. Friends of ours have been trying to foster for some time and had quite a while ago, and found the traveling involved for interview from one end of Powys to the other was prohibitive, really. And I'm assuming that measures have been taken to make that interviewing process more convenient. Lynette, is that the case?
Yeah, I think when Sharon can come in here, she probably got better knowledge of this than me. But I mean, these days we've got, you know, as we have to have today, you know, we can meet on Teams or Zoom and things like that. So that, you know, we're in a different place now that we can actually, you know, interview, work with families, you know, digitally. So that has improved. Thank you, Councillor.
Great, thank you, Lynette.
Lynette, I've seen recently online that there's been, you know, a foster couple who have been really showcased as and won an award. I wonder whether we could get some, when we have a full council, or tag it on to a member development day in person. It would be fantastic for councillors to hear from one or two foster carers about the work that they do. You know, if that was appropriate. And I know we do a lot online, but I'm just wondering whether there's, you know, an action day or a foster carer day we could think about doing in the county, which I don't know how that would work, but it just
Yeah, I quite agree with you, Councillor Jenny. We did have Foster Wales recently in the carousel marketplace in County Hall on full council, and that generated some interest, which was good. We also plan, as you say, you know, there are, you know, our foster carers are fantastic. They do a fantastic job getting the messages out about the awards. I think is really important, and having their testimonies about the work they do and how how they feel they benefit from it, as well as the children. So I think we've got some comms to do around this as well as we move forward. But I quite agree. One of our foster carers had an award in the Royal Welsh Show this year. They were awarded there. And so I think it's really important that we get some comms out around this. I know it's part of Sharon's plan going forward. Quite agree with you.
But also, I think that it would be good to hear about some of the fantastic support that they get as well. I recently heard of a foster carer who'd looked after a child who had been very unwell, and now that child has gone back to their family. And as a thank you, they were given a rose for their garden in the name of that child. And I just thought that was a really lovely touch. And actually, the getting the message out that the support that foster carers get is good. I do have a couple of quick questions. I can't see any other hands up. On the terms of the things that are off track, Sharon, one is to do with children's placements for 16+, and there's been an issue with fire doors. I realise that this is a collaborative arrangement. Can you just give some background as why has this become such an issue, and who is supposed to be from their end leading on making this work and happen at pace?
Yes, so fire doors is a complicated issue in that we work very much in collaboration with housing around installation of fire doors. But like lots of things, there is a backlog in terms of the distribution of the fire doors into organisations to then fit. So there is an 8-week turnaround from the point of placing an order to then obtaining the fire door to then enable that to be fitted. So we do work very closely with housing on that. And they work as speedily as they possibly can with that. But it is something around that kind of demand on that particular product that becomes a complicating factor to kind of even get it into Powys to then be able to fit it. So there have been delays, but just to assure you, those fire doors now are fitted in the properties in which we have got, and we very much then we have to have those as a legal requirement in terms of developing that provision, in terms of making it regulated. So we very much work with our corporate business partners around those fire risk assessments, the fire doors, any health and safety matters at all in terms of those properties.
Okay, thank you. And then going forward then, if that was to happen again, is that something that Nina is aware of to make sure that we're prioritised?
Yeah, so we're fully aware of it. It's just there's a national shortage of that particular product to bring it into the organisation, so everybody's aware of that, and I guess it's about just forward planning. So we're not looking to secure any further properties right now, but the ones that we have got, all of that has been actioned appropriately. It's just those delays were out of our control, really. It's to do with the product actually coming into the organisation rather than the organisation itself.
Okay, thank you. I think that's answered my question. I've also got a question on the in one of the sections, which again is where it's not quite on track, and it says 90% of children, young people and their families report that they achieve their family goal through accessing early help, and then we've got a performance of 80% against a target of more than 90%. Can you just explain the background to that and what that means and why it is we're not on target there and what we're doing about that?
Yeah, so this is around our early help provision. So within the early help service, they use what they call a distance travel tool. And that distance travel tool tracks and monitors the progress from the start of the intervention right the way through to the end. And what we've discovered in terms of analysing the information and the data is that not all staff were using the distance travel tool in the way in which it was intended. So hence why there's actually the data actually hasn't met the target. So what we've done further is done some further training and development with our early help team. There's new staff that have started in the early help team, for example, and it wasn't until we sort of saw the data that we realized actually there was something that wasn't working quite right. So it's not so much that interventions haven't actually happened. Okay. It's more to do with the fact that people haven't been filling in the distance travel tool in an appropriate way for us to be able to measure it. So we're hoping that will improve over Q3, or it should do.
Okay, that's good to know. I was concerned that it was early help strategies that were not on track as being resourced sufficiently.
No, it's more like I said about the use of the tool.
Yeah. That's fine. Thanks for that clarification. Councillors, anything else on children's before we move on to adults? No. Okay. Nina and Michael, I'm not sure who's leading on this one, but please could you take us through the high level aspects of performance on adults, please?
Yeah, thank you, Councillor Amanda. Sorry, Michael, should I just say a couple of words and then hand over to you? Yeah, thank you. Thank you for inviting us to come to Scrutiny today. I'm sure you've all seen in the press and the media the ongoing challenging times across the health and social care system. We are still during this Q2 period seeing sustained high levels of demand and also increased levels of complexity as well. You'll see as well there's often a mention of ongoing issues with recruitment and retention. These are obviously national issues, not just Powys issues, but you can see that reflected. And if that's okay, Chair, I'll hand over to Michael to take us through the detail. Thank you.
Thanks, Nina. Morning, Michael.
Morning, Chair. And thank you, Nina. Before I provide some brief updates, I just wanted to once again thank our staff, both across commissioning and operational teams in adult services. They really are our greatest asset, and they continue to work tirelessly to support our residents day in, day out. As Nina has mentioned, it has been another challenging quarter for adult services, ongoing internal recruitment and retention issues, sustainability issues within our provider market, sustained high levels of demand. Despite that, I think we've continued to focus on a strength-based approach to delivering care and support, and that's based on the ongoing demand management objectives that you can see in the performance report. So this is about making sure that as far as possible, we're able to continue providing effective information and advice at the front door. It's about managing demand effectively for care and support in the community, supporting people to move out of hospital in a timely manner, making sure that we're reviewing packages for individuals that have got long-term care needs as regularly as possible, and of course doing all we can to ensure the sustainability of our workforce. We're particularly happy to report at this point that we continue to make progress on our extra care ambitions. Works in Welshpool and Ystrad are underway, and this is a key aspect of our accommodation strategy in the service, because what we want to do in the longer term is change the profile of demand away from residential care towards supporting people to live independently in their own homes and communities for as long as possible. With regards to self-directed and more personalised forms of support, it's also encouraging to see that the number of individuals receiving a direct payment continues to increase quarter on quarter, and that provides more choice and control for residents about how eligible care and support needs can be met. Both Nina and myself had mentioned pressures on recruitment and retention. We do have a corporate recruitment and retention working group that's been doing a lot of really useful work at pace. So we're working closely with digital services, for example, to reform our onboarding processes. That's about making it as easy as possible for people to apply for jobs in adult services, and in particular, some of our frontline practitioner posts around domiciliary care and reablement. We're going to be commencing a new recruitment campaign in the new year. And we're also undertaking a market comparison exercise at this point in time to better understand how our pay and terms and conditions compare with other authorities. So I think that's it from me in terms of a high-level overview. Rachel, myself, happy to answer any questions that you may have.
Sorry, I'm just choking. Sorry, everybody. Yeah, I've just put a message in the chat box just to apologise really to the portfolio holders to not introducing them yet this morning, but please feel free if there's anything that you want to chip in or add at any point. Councillors, I know some of you have some questions on this, and because I'm still trying not to cough, I'm going to hand straight to Gareth, who's got his hand up.
Yeah, mine's just a very quick question for clarification, really, from what Michael's just said around the direct payments. How do we as an authority monitor the use of those direct payments funds?
Yeah, thank you for the question. So our default means of administering direct payments now is through what we call a virtual wallet, and that's essentially an online bank account which makes it as easy as possible for the recipient of the direct payment to pay their providers in order to have that care and support delivered. So we've tried to reduce any of the administrative burden as far as possible to make it as easy as possible for people to use those direct payments. In terms of how we monitor, we review care and support plans that are funded through direct payments as we would review any other care and support plan, and that gives us the opportunity to make sure that the amount of money we are providing is still proportionate to the eligible care and support needs, and we look to do that in quite a holistic way. So that's not just a review with the individual in receipt of the direct payment. It may be the provider and other interested parties such as family members. So I think it's through the reviewing process that we look to monitor those direct payments on a regular basis.
Thank you.
I think also we've got direct payments on our forward work plan, because we'd quite like to do a working group on that in order to hear from some service users directly on how they find the systems, etc. Councillor Liz, I think you had some questions on the backlog side of things and tying that in with sickness levels.
Yes, thank you, Chair. Yeah, it's a bit of a sustainability of the workforce question, I think, but a while back we heard there was a plan to get commission and bring people in to do the reviews that were at the backlog of reviews, but you know, I understand that didn't work, and the plan then was to pay overtime to staff to do that. Now, I did see in the sickness, the aggregate sickness, that it's at 3.97%, but that the highest sickness is in children's services, adult services and highways, which in many ways is not surprising. But I just wondered if Sharon maybe or Lynette could say whether or not they've got concerns about the levels of sickness in children, adult services, and you know, whether or not the sort of work on overtime and doing reviews is likely to impact on that. So, you know, is this going to sort of undermine the sustainability of the workforce? Because it's winter, you know, and people do get sick, and the front line is obviously the place where you know, this impacts the greatest. So, you know, it's a sort of open question really on that. If anybody could, you know, give some assurance, or if not, you know, the concerns that you might have.
I'm happy to answer, Councillor Liz, from an adult services perspective. I think it's a really important question, and there's a really delicate balance to be found here, because we have got a high number of fatigued staff working in the service just now, many of whom are working above and beyond their contractual hours anyway. Yeah. The last thing I want to do as a head of service is create more demand on these individuals. And that was the reason why in adult services we looked to commission 2 managed services, one to help us deal with a backlog of care and support plan reviews, and the other to help us deal with assessments that have not been undertaken at this point in time. Unfortunately, the organisation that was undertaking reviews for us weren't able to meet the terms and conditions of their contract. So we're now actively looking to see how we can use that money differently between now and the end of the financial year. What I've decided, for the reasons I set out, is that we will look to bring in short-term agency support as opposed to trying to ask staff to work more hours, because I don't believe that that's particularly sustainable given the pace that staff are working at this point in time. We are also looking to use some of that money to bolster our capacity around our internal domiciliary care, because I think there's 2 capacity issues here. One is around having the opportunity to assess people in a timely manner, but of course once people have been assessed and a care and support plan is put in place, that needs to survive contact with resources. So there needs to be some sort of provision at the end of it. So we're trying to work to come up with an equitable approach that allows us to bolster our capacity around assessment and short-term domiciliary care provision. I don't have any concrete updates on that just now, but it's something that we're actively working on in the background to see if we can get online.
Like
Michael,
on children's,
can I just ask a quick follow-up on that though, just to Michael, what he's just said? Is the capacity within the agency market to fill those?
Well, okay, so the agency market, I think we need to watch this space. At the point that we recruited the managed services, that was because it was particularly difficult to recruit agency social workers. That situation may have changed for the better, which is why we've got officers currently liaising with our agency that puts us in touch with agency social workers to see if that capacity is available. So that's the strategy that we're adopting at this point in time. We have found in the last few months that it has proved a little easier, or less difficult, I should say, compared to previous months to recruit short-term agency resource. So we're hoping that capacity will be there.
Okay, thank you. Sorry, Sharon.
No, that's okay, no problem at all. So just to answer the question in terms of children's, I think I'm most worried about resilience, really, for the reasons that Michael highlighted in terms of that continuation of working in really challenging circumstances from the pandemic and still right through to today. We again have had 2 managed teams within children's services. I have to say and reflect on the initial managed team that came in, that didn't have the desired outcomes that we intended in terms of practice. So whilst it did meet the demand in terms of having social workers within the service, in terms of the actual practice within that managed team, we ended that contract early because it didn't actually fit the requirements of what we actually wanted. And part of the reason why our child protection figures actually increased is as a result of having a managed team in place that didn't really understand the practice and the processes around children's services here in Powys. The second managed team, however, there was a very different outcome. The practice was much more positive, very much more in line with what we expected. And we've actually ended that managed team earlier than planned. So we will recoup some savings from that. But what we've also done is managed to recruit some of those social workers where there are still capacity issues to come into the service as agency workers. So then we actually manage them ourselves rather than have them being managed by an external team. So I think that actually is a better outcome for us in terms of creating that sustainability around the continuation of practice in the way in which we want to strive to achieve. So what I mean by that is continuing to reduce our children on the child protection register and continuing to reduce our children looked after figures. And quite often when you bring other workers into the workforce who don't understand or haven't practiced using signs of safety or work in a strengths-based approach, you can very much fall into risk-averse practice. And we very much want to build on strengths and we want to work on all those key objectives that we've set. So again, like Michael, we've seen a difference in recruitment of agency workers over the last couple of months. There are some national standards that have been agreed by ADSS in terms of all the directors across Wales, whereby we have signed up to an agreement around not recruiting agency staff that have recently been in another Welsh authority, looking at our particular pay rates so that we're not offering higher amounts than what we have done previously. And I think that's actually helping kind of create that opportunity for people not jumping from one authority to another authority to get a better pay rate. So I've held really firm on our pay rates here in Powys. They are lower than lots of the other authorities, but I absolutely feel that is the right way to go. And we haven't seen a major impact in that position as a result of not being able to receive CVs for social workers coming in.
Okay, thanks, Sharon. Councillor Liz, did you want to come back?
Well, only just to ask about sickness and, you know, whether you, well, I'm assuming that that is something that you'd be concerned about, but could you just say a little bit about what it is like in children and adult services at the moment, the sickness levels, and what you might be doing to ameliorate it?
So within Children's Council, we monitor our sickness month on month, and our HR business partners provide us with a report on that, which we scrutinise at our children's leadership team. So when we look at the comparisons of pre-pandemic, during the pandemic and post-pandemic, whilst we recognise we do have sickness, our actual figures aren't increasing in terms of children's services. But having said that, we still do have sickness. And of course, we're worried about sickness and what that means. So we very much kind of track what those reasons for sickness are, particularly if they're stress-related, work-related periods of sickness. We have a very sort of tight process on making sure those staff receive the support in order to kind of come back to work or to feel physically and emotionally better. So we spend a lot of time looking at resilience and looking at how we can develop the well-being aspect of the work. What's really important within that is supervision and appraisals and those reflective practice opportunities. So we've really kind of, whilst our figures on supervision and appraisal at the beginning of the year were lower than we expected or wanted, we've certainly had a much clearer focus in the autumn on supervision, appraisal, reflective practice, bringing practitioners back into offices to be able to have those conversations and that support from their colleagues and internally, and that in turn will help with those feelings of isolation or feelings of stress, etc., which is what sometimes can be a common theme. So we very much kind of scrutinize all of that on a month by month basis in terms of monitoring the percentage, but also looking at what we can do differently in order to support the well-being of the staff.
Okay, thanks, Sharon. Lynette.
Yeah, thank you, Chair. Yeah, absolutely concur with what Sharon has said there. We have a comprehensive report but from the HR business partner, and at the last business partner report that we had, the sickness levels within children's services were good, as in the staff were in, and as Sharon has rightly said, I think it's, you know, the supervision and appraisals and giving staff, you know, time with their well-being. The job, as you know, is really hard. They are, as Michael said about adults, our workers are working above and beyond. They're working long hours, you know, on duty, and we want to commend them for the work that they are doing. And actually the sickness levels in children are, you know, surprisingly at this moment are good, but we are keeping a track on all of that on a regular basis, as Sharon has said, and making sure if we've got staff that are having difficulties, or maybe, you know, making sure those appraisals and supervision there, that we're making time for our staff. Their well-being is very important because it is very difficult out there on the front line still at the moment. Thank you.
So when we get November's performance report, can we expect to see supervisions improving?
Yes.
So
Yes.
in terms of the numbers? Yeah.
Yes.
Okay. Councillor Gareth.
Yeah, just follow up what I think Sharon said in a reply to the previous question. Did you say that you're encouraging officers to go back into the office, and what is the authority's policy now? I work with apprentices in 7 or 8 authorities in England, and they're all looking at hybrid models of officers being in the office 2 to 3 days a week, and I just wonder what the council's approach to that was.
Certainly from Children's Services Council, is my thinking is very much we want our staff to be back in offices at least 2 to 3 days a week, like you suggested. That really is to get that peer support, those reflective opportunities, those conversations when you're dealing with really difficult and complex and risk situations. We very much have a hybrid approach, and that is the council's approach is to hybrid working, but definitely for us in children's services, I'd like to move a little bit quicker with us coming back into offices in the ways in which you suggested and said, and for the reasons that I mentioned.
I think from my point of view, that may well be very welcome by a number of members.
I can see there's a couple of hands up. Just to say that I want to move on to finance shortly after 11 o'clock. So councillors, start thinking of questions and any questions on adults, because I feel like we've asked quite a lot on children's. Councillor Sandra, did you want to come in on that?
Yes, please. Thank you, Chair. My apologies, first of all, for being late. I had huge problems in getting in. Thank you for the staff who helped me on that. Just to come in regarding the staff and morale, etc. I have met a number of staff and spoken to them and asked them how they are finding conditions and working, etc., and the pressures. And they were telling me in a conference that I attended that the feeling is that they would welcome going back into offices because they miss that that opportunity to offload with their peers. and obviously it's in that confidential mode that they can share experiences, etc., and support each other. So just to say that I know that the staff are working flat out. They have been under very, very intense and difficult circumstances, with staff going down with COVID, people being off, and they're trying to cover, but trying to tick all the boxes, because we cannot afford to make a mistake with children services, but the staff are doing all they can, I can assure you on that. So just to thank the staff that are working with them. So just to reassure you, we are on the case and we're watching, and we're trying to do our best to support the staff as well. Diolch yn fawr.
Thank you. Councillor James.
Chair, I only come in now if the members have no further questions, because I know
I've got a few on adults, James.
Okay, but I'll wait.
Okay, so I've got a couple of questions on adults side of things. First of all, obviously we know about the pressures with the domiciliary care market, and that this is not just unique to Powys. But I wondered, are you working with other local authorities to raise issues together with Welsh Government in terms of making sure that any support that we are hoping to get will be, come directly to local authorities in a ring-fenced way? I'm talking about, barneted consequentials, but also, where you can share things that work for you in a rural setting, where a lot of the solutions that might come out of other local authorities might not be appropriate to Powys. So are we doing stuff at a national level in terms of those kind of pressures? That's my first question.
Thank you, Chair. I attend Association Directors of Social Services, ADSS meetings. Excuse me, sorry, I've got a bit of a poorly chest. So I attend meetings with other directors of social services across Wales at least once a month. Sometimes it's more often depending on the need. And as a group, we also meet with Welsh Government, Albert Heaney, at least once a month as well. So as a group, we discuss challenges, issues, concerns, and then feed those back to Welsh Government as well, as appropriate, and to ministers as well. So Sharon referenced earlier the work that ADSS has done as a group of directors to try and help issues with recruitment of agency staff within children's services. So when Sharon was talking about, not employing another agency worker that's worked in another Welsh local authority for 6 months, etc., not increasing prices, so not competing against each other as local authorities. So, as a group of directors, we've done that work. But yeah, there's a lot of work ongoing. We do feedback monthly and regularly to Welsh Government, as I said, so that work's ongoing as well. And of course, some of the heads of service as well will be attending group meetings as well, with their respective heads of service across Wales. So there's quite established frameworks and governance arrangements to be feeding back up to Welsh Government, etc. Thank you. Sorry, apologies.
Thanks, Nina. Rachel?
Yeah, thank you for that. I just wanted to add to that really helpful context. So Powys have recently volunteered to be part of an ADSS working group, recognising the national pressures that all local authorities are facing around the domiciliary care market. And one of the outcomes of that working group is to explore a range of different models, such as a franchise model. So we've signed up to that. We are fully participating. There was an initial meeting, I think it was 2 weeks ago, to look at the scope of that piece of work. So we are right at the heart of those developments. So just wanted to make you aware.
Thank you. Thanks for that context. Yeah, no, that's good to know. Strength in numbers nationally, I think, is the way forward. I've got a question on the adaptation side of things. I don't know whether this is best for you, Michael. Again, it's in the report, and it says that there's a bit of an issue here. There's a target of getting sort of adaptations in place within 130 days, but we're sort of working at 170 days. What's holding that up, and what's being done to try and mitigate it?
Yeah, thank you, Chair. I think there's a couple of things going on here. There's been a recent restructure within housing services, And there's also been a recent change in supplier for our community equipment service. And I think our occupational therapy team are working really closely with colleagues to make sure that we've got seamless processes in place to try and reduce that time taken between an adaptation being identified and it actually being implemented. I think to a certain extent we may be victim of wider supply chain issues at this point in time, which is affecting the ability of us to secure the actual equipment in a timely manner so that those adaptations can be made. But we work very closely with our housing colleagues, and of course we're all part of the same directorate now. So our occupational therapy team leads across both the north and south are in regular correspondence with housing colleagues, and I know that there's a lot of really important work going on in the background just now around how we can strengthen those processes, and that may be something that we want to focus on in terms of the forward plan.
Yeah, absolutely. I think I'm going to come on to this later when we talk about the working group last week, but one thing I think we're keen to hear is what, as a local authority, we're doing in terms of preventative measures, and adaptations I think are key to that because they enable people to live safely in their own homes with minimizing the risk of trips and falls, etc. So yeah, I think that's spot on. Councillor Gareth, I'll take this as the last question on performance. Thank you.
Yeah, my question, because this is the Q2 performance report. We're now only 2 weeks away from the end of Q3. And I know there's specific reasons why the reports are late. I just wondering whether officers could give us an indication how we're performing against the 11 or 12 red objectives and measures that are detailed in the report.
Thinking ahead, I like it. Who wants to answer that? Nina, Lynette? Are we to expect improvements for Q3?
Sorry, Chair, I'm afraid I don't have that information to hand, so I wouldn't be able to answer it. So I wouldn't want to say one way or the other. Apologies.
Okay. No, that's all right. Lynette, is that the same for you? Or Sharon? Oh, you're on.
Yeah, similar. We'll be starting now our quarterly three internal reporting in the next couple of weeks. As Councillor Gareth has rightly said, we'll be looking at Q3 now. Internally first, we look at it, then we go through a robust process with our portfolio holders, and that process for Q3 is happening internally in the next couple of weeks, so we can give you a more detailed update on where we are now after we've had those internal meetings.
Thank you. And perhaps one question, if I may, Chair, and this is I think this goes to James more than anybody else. Having read the report, there's some significant issues just within our service, but when you look at the recommendations of the report, they are pretty general, pretty weak, and don't actually say anything, in my mind. That's only a comment.
Are you talking about in terms of the actual contents of the report and the action point?
No, the actual content. You go to the report, last page recommendations. There's two very, in my mind, soft recommendations, and doesn't actually, I read that and come to the recommendations and almost thought, what's the point of the report?
I think that's something for them to take away.
Yeah. So I'm only making the point.
No, that's okay. Right, Councillor James.
Yes, thanks, Chair. I mean, I can't speak about the detail. Obviously, we're not had sight of up-to-date performance figures. You're right. Members are right. This is historic, really, almost now. 2 months ago, at least more than 2 months ago, it was the end of Q2, and I think we all can see, even the most casual observer of what's on the news can see that the situation in not just with the health service but across all public services is very concerning, to say the very least, and that's a modest way of putting it. I know we're seeing industrial action today. I think for the first time ever, the Royal College of Nursing has members out on strike, which we would never have believed could happen, and it's a manifestation of the pressure that they're working under in the field, and that they are very under rewarded for the work that they do, and it is just a a symptom, if you like, of what is of the malaise that is affecting public services across the board. And if our performance in Q3 is as good as it has been in Q2, that would be actually, frankly, a remarkable achievement given the circumstances we face with the exponential increase in demand across all care services, and the ongoing problem of staff recruitment and vacancies and all the things you've been discussing and so on. So, and COVID has not gone away. It is affecting staff absence and at all levels, and this is hampering the operation of all services. So these are really difficult times. I have to say, I can't recall a time since I've been a county councillor when I've thought that the whole of the public sector is under such a fragile condition. And it's quite clear from our meetings, which Nina and others attend with health board, senior health board officers and the chair of the health board, that they are deeply, deeply worried about the situation in the health service, which, is, as we know, inextricably linked to our own social care services. So this is I think members need to be aware this is a really, really difficult moment, and to get through the next 3 months to the spring, especially if the weather stays as it is at the moment, exceptionally cold, this is going to make matters even more difficult. So I think I would ask members to be mindful of that, absolutely challenge as hard as they can on all these issues. And I think the debate you've had this morning has been really interesting, and members have really applied a really intelligent and inquisitive approach to things, which is really first class, and I can't fault it at all. But I just think as a leader, I am really, really very concerned about the wider situation, the wider context, and not just the issues that have been dealt with in the report today. So I don't want to sound depressing, but it is something that really is, I think we should all be very mindful as members and give the officers who are trying to deal with these things operationally as much support as we can, because these are really, really difficult times. Thank you.
Thanks, leader. I think from my perspective, that's why I'm constantly asking myself, what difference can scrutiny make? I don't want it to just be a talking shop. I want us to be constantly asking ourselves, so what? We've made this comment, so what? So that's why I'm really keen to get our recommendations as pertinent and targeted as possible. And thank you for joining us. And I think we need to move on fairly swiftly, actually, because we've still got quite a bit to get through, and we've got to go on to finance. Members, if you do need to take a comfort break, please just turn your camera off and go. I'm not going to pause because we've got so much to get through. So turning now to the 5.2 on the agenda, we've got Q2 finance report. Again, we've all read this, so please, directors and heads of service, can we just have some high level overview? And I think I'd like to start with children's, so that I make sure we get through that, because that's where the areas of financial questioning, I think, is going to come from our end. So Lynette and Sharon, and I can see Jackie, welcome to Scrutiny. Over to you, whoever's leading on this, please.
Yeah, thank you, Chair. So you will have seen the finance report. So that is the information and figures presented within this report. There are a number of complicating factors within the report, as you will have seen, and some of that is in line with what I've said earlier in terms of placements and the cost of placements and the cost of residential provision that is required in order to meet the needs of some children. That market is kind of increasing in the cost. So those placements become fewer and the market price goes up. So hence why we've had a continued trajectory really of that as an increased pressure for us in terms of the budget. Again, in terms of what we've already said and talked about in terms of resilience within the workforce and the ability to recruit and retain staff. We've had to rely on agency workers, and you will have heard me already say about the costs of agency workers and what that means. Therefore, I welcome that position from ADSS Cymru around capping those prices, because again, that is a captive market for those organisations. They can increase those rates at any point, and you'll have heard me say that actually I want to hold firm on those rates and not go above what we've already predicted. Otherwise, that expenditure will just continue to increase in Q3 and Q4 because the reliance and the need of agency workers has continued. So those are really our majorly high pressures really in terms of placements, the continued demand coming through the front door, the requirements of what that needs, and also the reliance on agency workers in order to meet that ongoing demand. I don't know if Jackie wants to kind of come in at that point and highlight anything else, or Lynette, but welcome that if you want to make any additional comments.
Thank you, Sharon. Jackie, is there anything you want to add?
No, thank you.
Lynette?
Yeah, I'll just mention the fact, as Sharon has said there, you know, we have got a national problem here in terms of profit, you know, people having placements for profit, which is part of the national agenda to eliminate profit here. But we're in a situation currently where we do have some placements that are exceptionally high in terms of cost, and obviously, you know, this isn't the place for at all going into in any individuals, but you know, there are some very high cost placements, and we are part, as we've said earlier, of the national group. Nina is looking at this whole eliminating profit. It is a big national agenda, but we are where we are. We have to find placements for children. Sometimes we have to find placements very quickly, and they can be far away, they can be very expensive to place children, which is why our closer to home strategy is so important going forward. But we're not there yet. We still have children that are placed out of county, and those placements do cost. As Sharon has said as well, I just want to reiterate the fact in terms of recruitment and retention, again, this is a national problem as well. You may have seen figures in the press this week about the rates of capacity in terms of social workers and vacancies across Wales. It is a huge problem, vacant posts, recruitment, which is why our Grow Our Own strategy again is so important going forward. So really, you know, those are some of the key areas of expenditure within children's services that, you know, we have to meet a need, we have to make sure we meet and keep our children safe, but there are these national problems which we're facing in children's services in Powys in terms of cost of placements and in terms of making sure we got social workers to deliver the assessments, etc., and they can sometimes cost us more, although Sharon is holding firm to the market supplements, etc. But we are, you know, we've got other local authorities that will provide market supplements up to quite a number of £1,000, and that's what we're fighting, you know, the competition that we have. So those are some of the, just to reiterate and emphasize some of the pressures around budget that we're under, and those two issues in particular.
Yeah, thank you for doing that. I think it's a difficult one to communicate to the wider public, isn't it? Because on a very crude level, when you look at our numbers of looked after children, the numbers of children on the child protection register, and also now the numbers of front door contacts, things are evening off. So I think it's important that you give that context and maybe explore ways to give that context more widely in Powys to the public who perhaps would question why our budget in children's is under so much pressure when our numbers, you know, I know it's a crude way of looking at it, but if you put yourself in resident shoes, they want to see value for money here as well. And you know, last year we predicted that potentially there would be more children coming into the service, and that hasn't materialized. So could you just give a quick view, I think, on some of those children with the very complex needs? Why is it that those children are costing so much in terms of placements? What is it? What are the themes behind those really complex children, and what are we doing at a preventative level to address that?
Yeah, shall I come in first there, Sharon, just to say, in terms of some of the children and young people and the placements, we are in a place at the moment where providers can charge for profit.
Yes.
So this is the, and they name their price. That is this national situation, and that is what nationally we are trying to stop. So it's at the moment, some of the placements that are needed for children with complex needs that we haven't got in Powys, very specific, and sometimes there's an overlap with education, with ALN needs, and transport. There's an overlap there as well, and it can affect both children's service budgets and the ALN budget in education, so that the out of county placements and the making sure that those needs are met can be very expensive, because there is there is profit being made. So that
I think I've probably phrased my question the wrong way around, because I realised that they're charging for profit for those children that have the complex needs. But what I'm asking is, are there themes behind the complex needs where we're seeing more children with complex needs? And is there anything we can do to mitigate that in terms of prevention or collaborative working or early help, so that we don't have so many children with such complex needs? I realise, sometimes we don't find out about a family until really late, where, we would have wanted to have been supporting that family much earlier on. But what are the themes on those children, rather than the other end, where I know that's why the providers are charging for profit, because they see a child with such complex needs?
Shall I come in there, Lynette?
Yeah, fine. Thank you, Sharon.
So what we've done, Chair, is we are tracking all those children. We track all our children that are looked after, but what we've had a firmer and stronger emphasis on is those higher cost placement costs, and looking at what that's about in terms of those individual children. So some of these children will have been placed into care maybe 10 years ago, and some of those children at that particular time may have not had the services, whatever that might have been, whether that's to do with a complex behavior or an attachment difficulty, or whether there was a family dysfunction such as alcohol abuse or substance misuse or domestic violence. Those tend to be the environmental themes for most of the families and children that we work with. Therefore, that then manifests into trauma, and how each child kind of lives with and copes with and deals with the trauma of living in an environment such as that. So I would suggest to you that the preventative services, in terms of collaborative working with education and health and early intervention, is in a much stronger position than it is today, than it was going back 5 years ago, and certainly 10 years ago plus. There's much more emphasis on community-based working, such as with community mental health teams, with drug and alcohol services, with domestic violence services. So the themes in which children live within, I would say that there's a stronger focus across all services in health and education and ourselves on that early intervention and prevention. So if you look at Fly and Start, for example, there's been lots of money that's been inputted into Fly and Start through Welsh Government, recognising and picking up on those very early themes at the earliest opportunity. And then if you look at our child looked after numbers, although they have gone up in Q3, but there are specific reasons for that, and I think that they will come back down, is those themes have continued. Yes, those issues will become more manifested during the pandemic and during lockdown, but we're not seeing an upward trajectory of children looked after figures. So that kind of tells us that early intervention, that prevention work from that multi-agency approach is actually working in the ways in which it's intended. Some of the complexity around children with very high-end complex needs, as Lynette said, often translate into children with significant learning challenges, whether that's within behaviour or within their emotional well-being. And then we are having to find that provision more often than not outside of Powys into England, with the costs are astronomical and can be anything up to £10,000 a week for children. So the whole Welsh Government approach about non-profiting care and closer to home is to bring those children that might have been looked after, like I said, for many years back into Powys, looking at, can we step them down from residential into a foster family that then fits with our grow our own foster carers, dealing with more complexity in a different sort of way. So it's all kind of then looking at our foster children, can we actually can they go home now? So we're focusing on assessments with their families to look at whether or not it's safe for children to go back home. So whilst those children are in those high cost placements, our closer to home strategy sort of wraps around all of that in terms of cost. We know exactly who those children are, where they are, what the cost is. We've looking at all those individual plans to see if there's any possibility of stepping that down into a different plan. And at the other end, there's a lot of money and a lot of practice that's been invested in that early help, that early intervention and prevention, not only through social care, but through health and through education as well. And Flying Start is one of those areas that has really we've seen a difference in respect to that.
So I think what you're saying is those complexities are at the higher age group of children.
Yeah, that's right.
But you're seeing improvements earlier on.
That's
so
right.
So going forward, hopefully things should start to even off.
I think I think we'll always have children that have complex needs for a wide variety.
But we won't have
reasons,
children.
But we won't have the numbers.
Yeah.
We shouldn't see the volume of that.
Okay, thank you. Councillor Liz, you are going to ask a question about savings to do with continuing care that were unachieved efficiencies.
Yes, Chair. Thank you. Oh, yes, I wanted to get my camera on. The question was about the £800,000 saving that was projected in the budget for the cost of children who are looked after. And the saving was going to come from making sure that the costs are attributed across, other agencies that might have a stake in this. So, could you tell us whether or not you're going to be able to make that saving of £800,000 from that method? And I think it was sort of working with, across ADSS Cymru to do that.
So thank you, Councillor. So with continuing care, there's a very set eligibility in terms of criteria to meet continuing care. So it's a checklist that's been devised by health boards and which has been legislated in terms of Welsh Government. And you basically work with health professionals in identifying whether a child has continuing care needs. Those continuing care needs are incredibly complex. They're generally around medical conditions, whether there's life-threatening illnesses, whether a child needs oxygen 24 hours a day, whether they need particular medical infusions, whether they may have complex behavioural issues, whether they might have significant mental health difficulties. So there's a whole range of particular criteria that has to be met in order to determine whether that meets the criteria for what is called continuing care. There are no pooled budgets in respect of it, so it's very much whereas in adult services, it's very different with continuing healthcare. For children with continuing care, there are no pooled budgets. So basically, a child would have their needs assessed from a social care perspective and from a health perspective, and then combined, you look at the assessed needs of that individual child to see whether or not it meets a threshold for a continuing care plan, and then you have to work out who pays what percentage, depending on what the level of need is for those children. Historically, we haven't, with Powys Teaching Health Board, have maybe not adopted an approach that was really robust in assessing those individual needs whereby children might meet that criteria. So when this budget was set, excuse me for that, let me just have a drink. I've got it wrong.
I'm passing my cough on to all of you.
I don't know if I can speak now there.
Yeah.
I'll let you cover, Sharon. And I think I was going to ask a follow-up question on this as well, because obviously we were involved in the budget last year, and this had a red rag rating against it. I think when it was set as a cost efficiency. So my question, following Liz's question, is, you know, was that a realistic efficiency? And if not, now you kind of have worked out the process of how you're going to identify those cases which might be applicable. How, you know, can we make sure that next year's budget is more realistic in terms of efficiencies for continuing care?
Apologies.
Sorry, Sharon.
No, apologies. So yes, everything you've just said in terms of that's what our next steps will be. So what we had to do was go back to basics and almost reassess every child to determine the level of need and what that package of care would look like and what the cost implication would be. So whilst that was set in terms of the expectation, what we've actually assessed and seen is that actually that figure isn't realistic going forward, because there isn't the volume of children with those high-end complex needs that actually meet that criteria. So going forward, it'll be a much more realistic budget setting. And apologies, I feel like I can't actually speak now in terms of this cost, so apologies.
Okay. And do you agree, and I might be putting you on the spot here, and it may be more of a political question, but in terms of those thresholds that have to be met, do you think they're at the right place in terms of what constitutes health compared to social care?
With continuing care, I would say yes, because there is legislation that actually determines what that criteria is and what the eligibility is for that to be met. So yes, I think with lots of authorities raise the same kind of complications really in terms of getting those budgets agreed. But I have to say, in Powys, we have developed our working relations with Powys Teaching Health Board now. It's in a stronger position than it may well have been previously. And those conversations are being held with a much more open door in terms of those children's and their identified needs. So I think going forward, that will be much more strengths-based. It will be much more proportionate. I'll be able to look at the budget in a much more realistic setting rather than what the figure was predicted previously.
Okay, thank you. So you're confident we're not covering mental health, and they are?
Yes.
Thank you. Councillor Liz, did you have a follow-up on that?
No.
No, thank you. Other councillors, any other questions on children's? Can I just ask a quick question, just for an explanation really, on the cost reduction side of things that haven't been met in terms of the special guardianship order project? I can see that there's some narrative to say that the project plan is being implemented, but yet there's no team in place. Could we just have a quick explanation on and a reminder for councillors on what that project was, and also then from you as to why it's not, you know, why the team's not in place, and but whether you're on track for that happening within the next quarter?
So the special guardianship order project is a project that looks at special guardianship orders. So it's a different way of legally looking after a child. So you'll hear me talk about care orders. So when children are looked after, they couldn't be subject to a care order where the local authority shares the parental responsibility. With a special guardianship order, the child may live in exactly the same placement with the same people, but it's a different legal order. Under a special guardianship order, you're not sharing the parental responsibility with the local authority. The special guardian has the actual parental responsibility, and they share that with the parents. So it has savings attached to it in a different way. So the child isn't looked after, doesn't then have to have children looked after reviews, doesn't have to have children looked after visits, etc. really. So we're trying to, sorry, Chair, I think I'm gonna have to
Sharon.
get water or something.
Sorry, I think we'll let Sharon recover. Councillor Gareth, is your question one that potentially might be able to be answered by Lynette? And if not, I think we're going to move on to adults.
Well, this may be nailed answered by Jackie. There's two cost pressures there, one of 353,000 against BANI and one of 516,000 against children residential homes, both of which relate to the use of agency workers. I was just wondering what the percent, is what for, if we take BANI, for example, it's 353,000. What is the overall set budget for staffing? So, is it 353,000 above $500,000, or is it 353,000 above 2 million? Just to get an understanding of the percentage differential.
I haven't got that to hand. Can I look while we're continuing on adults, and I'll post it in the chat? Is that all right?
Yeah, that's fine, Jackie. Thank you.
That's
Thank you.
fine. Thank you. Sharon, I think we've covered everything, and I know you're sort of partway through answering about the SGOs, but I think we understand. Can you just quickly say, is it on track for that team to come into place before the end of the financial year?
Yes, so we have been delayed, but we're actually out to recruitment now to develop that team and get that into place before the end of the financial year. Apologies, everybody, for
no, that's
coughing.
okay. We will let you have a break now. Thank you very much, and sorry for requiring you to talk so much. Okie doke, finance for adults then. Nina and Michael, could we just have sort of high level overview? I can see you're on track to be within budget this year, which looks very positive. However, obviously you have pressures that are ongoing. So if we could just hear a little bit about that and any risks that you think could potentially come to light between now and the end of financial year.
Thank you, Chair. Yes, so we're projecting at this point in time a small overspend of £5,000 by the end of the financial year. That changes on a period by period basis once savings are actually achieved, and that's reflected in the ledger. And that is based on achieving a savings target of just over 3.4 million. We are currently on target to achieving that. 1.73 has already been achieved, and we've got assurance of the further 1.699 by the end of the financial year. But as you've pointed out, Chair, I would want to draw the committee's attention to future pressures. And I think in the main, this is in relation to potential increases in demand, more so than what we're contending with at this point in time. As we move into the winter pressures period, we know that that's often a time within adult services and the wider health and care system where there is increased demand that needs to be responded to. And also, I think, we're preempting potential increased requests from providers with regards to contractual uplifts given wider increases in the costs of running a business. There is an element of uncertainty there, but that's something that we monitor on a regular basis to try and understand what that's going to look like in terms of additional pressures.
Anything to add, Nina? No. Okay. Oh.
No, sorry, I was just having a coughing fit as well, so I'm glad Michael came in there.
We're all falling apart.
Yeah, sorry about that, but no, nothing to add. Thank you, Chair.
That's okay. Members, have you got any questions on the adults finance side of things? Councillor Gareth.
Yeah, my question is not so much for this year, but I think it's more for the 23-24 year. Within the budget that you've got, there's use of 2.4 million either from specific reserves or the COVID underfunded pressures. I understand that may well be one-off money. It's how the service is going to approach dealing with that pressure.
Yes, those reserves are one-off monies, so they can only be used once. As we've developed our FRM financial resource model going into 23-24, we have accounted for additional pressures within that year, and the mitigating actions are an extension of our efficiency themes that we've delivered savings against the past few years. So, for example, that's constantly looking at the strength-based reviews, making sure that existing care and support plans are as proportionate as they can be, continuing to promote direct payments as an alternative to traditionally commissioned domiciliary care, and also utilising as far as possible the likes of technology-enabled care, incorporating that into care and support plans so that we've got a more proportionate way of meeting needs. Over the past few years, we have been working really closely with our providers to make sure that we are getting as much value for money out of those contracts. That is becoming increasingly difficult because there's a balance to be found around achieving value for money, but at the same time encouraging providers to remain within the market because we've got a market management responsibility. I can't take any credit for the extensive discussions that are happening on this on a day-to-day basis. That very much falls within Rachel's domain, who's on the call this morning, but I can say that our commissioning team are working very, very hard with our providers to make sure that we can achieve fair costs of care that allows us to continue delivering the provision that's required, whilst at the same time doing our utmost best to make those contracts financially viable for providers.
Thanks.
Thanks, Michael. Rachel, have you got anything that you want to add from your side of things?
Just to, I suppose, just to repeat Michael's point, really, that we have a commissioning team that work tirelessly with providers, and I have to say that as a result of the pandemic, we have really, really good working relationships with all of the organisations. However, we do need to understand the real costs of care. So, you know, we have really robust contract management processes in place, which allow us to scrutinise some of those costs and to ensure that the costs are evidence-based. However, we are seeing increased pressures, and some of those relate to the pressures that we're already facing ourselves as an organisation. So we know that recruitment and retention is a significant issue for all organisations, and we know that they are heavily reliant themselves on having to use agency staff. So all of that, you know, contributes to the additional cost. We know that utility pressures, certainly in fixed services, are having an impact. So we are working really closely with them to understand the real detail behind those costs and to make sure that services continue to be viable.
Okie doke, thank you. Also, I know we're going to come on to this sort of slightly later in the agenda, but in terms of the investment side of things that you put into the hospital discharge team, and again, I'll give a bit of an update on this later, but could you just give an overview on how that impacts the budget going forward in terms of ensuring that we have people that come out of hospital in the right size packages and the potential financial implications of that?
Yeah, certainly, Chair. Thank you. So we have invested approximately £150,000 into the service in order to allow us to have a dedicated hospital social work team funded through our baseline budget. The immediate impact is it allows us to target a resource towards district general hospitals out of county, making sure that we're supporting POWIS patients to come back into POWIS as quickly as possible when they find themselves in an acute hospital out of county. So the capacity has allowed us to facilitate those hospital transfers quicker than before. Previous to having that hospital team in place, the expectation was that our community social work teams would be working across both district general hospitals and community hospitals. And given the geography of POWIS, that was just proving unsustainable. So I think it has been a worthwhile investment. And And certainly we had a working group recently where our hospital team manager was able to go into a little bit more detail as to what that impact has looked like in terms of reductions and delays from our district general hospitals. And I think as we move into the winter pressures period, it's absolutely crucial that we've got that targeted resource in place so that we reduce as far as possible from an adult services perspective wider blockages in that health and care system.
So in your view then, that investment was well worth it? Absolutely. Yeah, okay. Any members, have you got any other questions on adults and the financial side of things? I can't see any questions. I've just seen a response from Jackie in the chat responding to Councillor Gareth's question on the BANI staffing. Jackie has said BANI staffing and on cost budget is 848,000 in total for the year 22-23. The 353,000 agency overspend is additional over and above to date, assuming vacancies will be recruited from period 7 to the year end. Is there anything else to add to that point, Sharon or Lynette, in terms of the BANI financials?
I think just to say, Chair, that it remains a real pressure for us in terms of having agency staff in our residential homes. We have got recruitment fairs and we are recruiting, and those numbers are increasing in terms of permanent staff, but it still remains a pressure whilst we're reliant on agency staff.
Okay, thank you. Councillor Shan, jumping back to adults now, sorry.
Sorry, I'm a little bit tardy coming in. It was just on the agency staff point. I don't have detail, but I was at a meeting for cabinet members across Wales with the relevant ministers, Welsh Government ministers, just last week. And the problem of agency staff and services having to use agency staff and the competition that it creates as well is something that they're aware of, and they're looking to see whether there is something they can do on a national basis to address it and reduce that pressure. So I'm keeping an eye on those developments. We weren't given any detail.
Okay, thank you. It would be helpful, I think, if you have anything that's of note that you do get down the line, if we could have just a quick email from you that just to sort of fill us in, because I think agency cost pressures are going to be obviously coming back up again when we come to scrutinise next year's budget. Okay, I think that's it on finances then. I think the main action recommendation that we're probably picking up from that side of things, and I know I've asked Councillor Gareth to summarise recommendations and actions at the end of the meeting for everything, but I think just to put emphasis on the fact that for the children's budget going forward for next year, any efficiencies that are identified in terms of collaborative arrangements, you know, we would be wanting to ensure that they are really realistic going forward, given that they haven't been achieved this year, because we don't want to see we don't want to see this happen every single year in terms of such huge chunks of savings not being met. We'd rather know from the outset what the pressures are. So that's probably the main recommendation. Okay, so thank you for that. And now the next point on the agenda is risk registers. Now, I don't really want to spend too much time on this because I think everything that comes up for adults and children's has been talked about already in terms of the children's budget, the dom care, the dom care pressures in the workforce. And there's only one thing, if I can just get it up, I think there's only one thing that I think would be good to have a quick update on. So just, yeah, so the main things in terms of being high on risk registers are risk of social care provider failure in terms of care homes and dom care providers, which we've had full briefings on and we know about already from Michael and Nina, and then also the the issues with the children's budget. But the other thing on there is the WCCIS system, which has not been fit for purpose and has caused huge issues for our operational staff carrying out their job. Can we have an update on where things are with that in terms of the digital transformation side of things, and also how systems are working today and whether or not that risk is starting to de-escalate, please?
Thank you, Chair. I'll give an initial overview, and then if I could invite Michael and Sharon perhaps to provide a more operational viewpoint on it. The risk in the risk register if WCCIS is not fit for purpose, then it will impact upon the service area to carry out operational duties. So, it's all around officers and professionals having the information they need to make the right decisions, and it's about obviously very key to the safeguarding of children and adults in Powys that they have access to this information at all times. As you all know, there has been significant issues with the system in the past. Feedback I'm getting from officers is that I think things are generally improved, but not still to a place there where we want to see, I would say. I think the platform's a lot more stable, but there are still issues at times that come through. In terms of what we're doing, in the summer, we started a transformation of social services, digital transformation, sorry, I should say, of social services project. That's been led by a team from ICT. They're very much involving staff from across social services in this work as well, which I think is really, really important, and they've had really good engagement so far. As this project moves into the early months of next annual year, part of the review will be including considering the possible future options for a data management system. So the digital transformation is going to include, considering whether we stay with the system we currently have, whether we update, whether we go to a new system. So at the moment, all options are on the table, and options will be coming forward as part of this review in the next year, as in within early next year as well. Sorry, but I just invite Michael or Sharon in case they wanted to add anything to that.
Thank you, Nina. I think you've summed that up from an operational perspective. I think the feedback I receive from practitioners and adult services is that it still remains slow more often than it needs to. There are still outages, and when it works, it's still not as intuitive as it could be. So there is still a level of dissatisfaction amongst our practitioners, and this is a system that we rely on in terms of having the information on Powys residents to enable us to make evidence-based practice decisions and at the very least keep people safe. So it's very important that we get this right. Nina's talked about the digital transformation programme. We are currently arranging 4 demos to soft test the market, and then there will be a procurement exercise if that's deemed to be the next steps that would be commencing in the next financial year, but there's no confirmation that will happen at this point.
What are other local authorities doing in terms of their use of WCCIS? Are they looking at the same options as us?
I think other local authorities are aware of Powys's intentions and are watching with interest. It's a mixed bag across Wales. Not every local authority ever signed up to WCIS in the first place, and so there's mixed provision when it comes to these data management systems. There have been some local authorities that have come on to WCIS. There have been other local authorities that have never moved onto the platform and seem to be perfectly happy with the bespoke platforms that they're operating already. Thank
you. Just so members are aware, I realise that this is kind of a transitional. This issue with WCIS has kind of started before the election and now carried on. So some of you may not be aware of the historical issues that there has been with this system. Historically, I had asked Michael and Jan in a public scrutiny session whether historically any service users had been put at risk, and from recollection Jan had said yes and Michael had said not yet, and so the same question I will ask now, although I realise it's slow, but are service users being put at risk with with due to those issues?
From an adult services perspective, Chair, I've not had any reports in recent times to suggest that anyone's been placed at risk. However, what I would say is when the system doesn't work, it's got a significant effect on staff morale at a time where we need to do everything to support the well-being of our staff. In some cases, it contributes to the extra hours that our staff have needed to work previously in order to actually get information on the system so that we can be assured of the integrity of the data. So whilst I've not had any immediate risks from a resident point of view, it's still a serious enough issue that needs to be rectified.
So it's remaining on the risk register for now from adults. And Sharon, children's perspective, please.
Yeah, I would say the same as Michael. I wouldn't say that any child is at risk as a result of WCCIS. It's more the frustration and the impact on the staff morale around the ability to record in a timely way and losing information after you've spent time putting it into the system. So I don't think that children are necessarily at risk as a result of the system, but I think the system itself does cause a considerable frustration, and that has a direct impact on the staff.
So we're not seeing it like outages anymore, which is what I think had happened historically. Like it was down, wasn't it, for a while?
That isn't a common theme right now.
Good. Members, have you got anything you'd like to ask about the risk registers? Councillor Gareth.
Mine again is more of a comment. I assume what we've got here is just those risks that are shown as red and above. And when we had a presentation on Monday, training on Monday, we were shown the heat map for the services. Do I assume there is other risks that are known and being managed in green and amber?
Yes, Councillor, from an adult services and children's services perspective, we've got a range of risks that you don't see here in the committee today, and that's because they've not reached the threshold in terms of the probability and impact score to justify moving on to that strategic risk register. But that we have a number of other risks that we manage on a day-to-day basis.
I'm just wondering, Chair, should we at some time look at the full risk register for the service?
I think maybe it would be helpful for us to have it in our Teams area. And maybe if it changes on a monthly basis or I don't know how often you update it, or whether it's a daily basis or however, obviously we don't want you to have to put it in there every day, but if there's a link to it, then when as members we come to do our sort of monthly review of your performance reports, we could look at that as well as a bit of a checklist for us to go through offline rather than informal session, because it helps inform our questioning for sessions like today. I think that's a really good point, Gareth. And I can see lots of nodding. Is that something we can have access to then?
As far as I'm aware, Councillor, we'll take that as an action. And this is just a strategic risk register that's been scrutinised today, but there is the service risk registers below, and we look at them quarterly as part of the performance reporting. So if you do look at them on that timetable, I think that would probably be very timely.
Brilliant, thank you. I will speak to our scrutiny support about how we ensure that that's in our Teams area. So thank you for that. And I think that concludes the questioning on the sort of main parts of the agenda. So agenda item 6 is a working group report. Last Friday we had a working group on what Michael just talked about before, which was on the investment that's gone into the hospital discharge team in adults to work with district hospitals out of county in order to help ensure that patients are coming back into Powys in the most appropriate sized care packages. Oh, I can just see that Councillor Susan is leaving now. Thank you very much for attending, Sue, and sorry we haven't had a chance to speak with you in person. but yes, so we had a very good discussion last Friday. We were able to hear from Emma, who is the manager in that role, and it was really positive to hear about some of the good work that's happening in that team, and the relationship improvements. Well, I don't know if improvements is the right word, but a positive relationship with the health boards, and how that investment is in your view as service lead and director absolutely paying off. You know, from our perspective, that was something that we looked at last year's budget in terms of whether or not that would be a pressure that would be something that we would be happy seeing in the budget, just put some checks and balances in place. There was a few sort of proactive areas that you informed us about you're still working on with the health board. You mentioned about some of the sort of hurdles that you still have to overcome, being the fact that there's 2 brokerage systems in place with what you use in order to find placements with care homes, and that you're doing some work behind the scenes on hopefully realigning those 2 systems, and so it would be good to hear how that goes going forward. And you also talked about there's potentially work to be done on how we incentivize short-term care in care homes. Michael, do you want to just give a quick a comment on that side of things, on where you think we just need to do work on incentivizing that and why that's an issue?
Yeah, thank you, Chair. So we work to the Welsh Government Discharge to Recovery and Assess framework. The principles behind that framework is that, first of all, we shouldn't be assessing anybody for long-term care needs when they remain in hospital, because that's an unnatural environment in which to determine what people can do for themselves. And also, we should be moving people onto short-term pathways to give people optimum chance to recover in which to assess for any longer term care needs. Ideally, what we want to be doing is moving people straight from hospital to home. When that's not possible, we rely on step down provision, and within Powys we want to work closer with care homes so that they become a strategic partner in facilitating some of that step down provision. I think the incentivization comes into place because many of these care homes exist to make a profit, and it may be more financially viable for those homes to accept people on a longer term basis. So there's some joint commissioning work I think we need to do between ourselves and the health board to work with those care homes to help them see their place as providing some of that short-term provision. That leads to questions around whether or not there needs to be different rates, whether it's about short-term or longer-term care. So that's discussions that we're having internally with the health board at this point in time, with a view to having further engagement with care homes in Powys.
Yeah, and thank you, Michael. I think our main action that came out of it from a committee is that we've got on the work programme for next year for the health board to come, I think in June time, and we'd like just to write to them in the new year to sort of outline some of the areas where we'd like to hear from them, this being one of them, so that some of these things that you're working on behind the scene, you know, they're aware that we're interested, so that you know that we hopefully help those things carry on moving forward with pace. Councillor Jonathan. Oh, Councillor Jonathan, you had your hand up.
Sorry, yeah, a very slow meeting. Is it appropriate for me to make a comment on the back of Michael's comments about care home and care home facilities at this point?
Yes, as long as it's sort of not relating to any service users, you know, that you're going to mention or anything.
I will then withdraw that potential statement. But yeah, I think only to say that Michael identified some tensions within the care home service and the ability to discharge from hospitals into the care home sector or home, and I could only agree that the situation is at least as serious as he indicates, and will probably become worse from my experience.
My suggestion is, Jonathan, if you're aware of specifics, that you pass those on to Michael behind this offline.
I will do that. That's really useful. Thank you.
Yeah.
Thank you, Chair.
Rachel.
Yeah, thank you for that. Just wanted to add to that point. So we are really working closely with Powys Teaching Health Board at the moment. And in fact, we have a session arranged for next week on the 22nd of December to work with care home providers and domiciliary care to proactively look at their pressures and to work together to understand what we can do collectively to support the sector, especially during these challenging times, essentially around business continuity, but also some of the range of different issues that they're facing in terms of some of those pressures. So we have that workshop arranged with them, and as I said, that's a joint approach and a joint conversation that we're going to have with them.
Right, Rachel, what's the outcome of that workshop? Does it lead to an action plan, or is it just, is there an action plan already in place that you're working on? How does that be proactive?
Yeah, so what we want to do is to have a really honest and open conversation with the sector. We already know some of the pressures through our joint contract monitoring. We have regular MDTs with Powys Teaching Health Board. So we already know some of those pressures. We know the issues relating to staffing. We know some of the issues relating to quality as a result of some of those staff pressures. But equally, we want to understand from them collectively whether there's anything that we haven't thought about, anything that we haven't done, whether we can be really creative in terms of, as a sector, and are there things that we can do as a local authority and as a health board to support the organisations in terms of some of those pressures, and to explore things that we may not have thought about. So it's just an opportunity to take stock and reflect, and to understand whether there are things that we need to do differently.
Thank you. Just to finalise then on that last agenda item, is the other thing that came out of that working group is that it was mentioned by one of the officers that potentially there is more work we could do as a service around prevention of falls. And there is work that's already in the pipeline that you are doing, and so I think that would be something that would be worth coming to scrutiny in the future, and for us to put on the work programme, for us to hear about that, and how that work is going, and what difference it's making. And I think that's it. So before, I think we don't need officers to stay for the last couple of agenda items, but thank you so much for coming to scrutiny today, to all the officers. It's been really helpful. I'm sorry, Sharon, that we have wrecked your voice so you're coughing so much. I hope you feel better soon. I see that Nina has already gone. Thank you also to portfolio holders. Sandra's still here, and Councillor Shan as well. I know Sue has already gone. But we do really appreciate you coming and being very candid with us, and I hope that you can see that we want to help make a difference, and we're not just asking you to come and talk at us and wasting your time, because that's the last thing we want to do.
Thank you all very, very much. I appreciate it, and thank you for your questions. And it helps us to focus as well, because we need, sometimes if there's something that we think we're going slightly off track, you're pulling us back in. So thank you very much indeed. Diolch yn fawr.
Thank you. Thanks everyone. Right, if members of the committee can just stay on. Councillor.
Thank you, Chair.
Thank you. Councillor Gareth, have you got a note of actions and recommendations that we've come up with, just so that we can make sure that that's been captured in the minutes? Okay.
Yeah, I have. I'm just trying to get it up on screen. I'm going to share my screen in a minute. Sorry, I'm messing around with this.
Oh, well done. Can you actually share your screen?
I will see now.
if we just have a quick look at this and then.
Can you see that?
Oh, well done.
Yep, I can see it.
Okay, so so on the performance side of things, yeah, we've got structure of the report. Yes, that was to, I think that's a really valuable recommendation because it did jump between services, didn't it? So have a clear thread. We've got looking at county farms as potential being used in the I think not just as homes, but also potentially respite or how they could be used within the service. Jonathan, was there a recommendation from you about travel for foster care assessments? Councillor Jonathan?
Yes, sorry. Yes,
sorry.
Yeah. Yes, there was.
Yeah, so I think we could potentially put that in there as well, just to ensure that they are not putting onerous travel for prospective foster carers, so that make sure it's as user friendly as possible. I think that would be something for us to put in.
Yeah.
Then I've got a couple of notes for forward work programme. Also, Gareth, you made a comment at the end about the recommendations and whether or not they were robust enough. I think we could phrase that as a question for the Cabinet to consider whether those recommendations are at an appropriate level to ensure that those red flag areas are actually having all of the resource behind them that they need, because I think you're right in terms of the way that those recommendations were phrased at the end of the performance report are quite like they're quite vague.
Yeah.
Yeah, and then fine.
Could I just mention, Chair, sorry, in relation to the performance report, that was the same performance report which came to the Economy Committee, which we commented on Monday. My understanding, and I think it's an important factor that you come up about the robustness of the recommendations, but they are looking to change the presentation of that report in line with the new corporate objectives coming forward. That was my understanding. So I think this is quite timely going in to making sure that the performance report is fit for purpose for the new objectives that will be coming through.
Good, thank you. Yeah, no, I think that's good that we get that in here then as a recommendation. Yeah. So thank you for that. Finance side of things, I think you've captured everything that I can recall about the efficiency savings for children's being realistic and achievable in the next financial year. And I didn't.
The only area I picked up after Amanda was the fact when Jackie sent that reply round Banai.
Yeah. In
my mind, it clearly shows that overspend is actually going to increase, because she said it's assuming there's going to be full staffing from period 7. Well, that's never going to happen, is it?
Do you think then the narrative that sits with that there needs to be an explanatory narrative for that?
Or should we be looking at two figures, what the position is now, what is projected position for the year end?
Yeah, splitting it up. Yeah, okay.
And I'll think of something to put in that.
Yeah, okie doke. I think just for clarity as well. Then for risk registers, yes, we've put the full service risk registers to be added to the team shared area, and I think that's then for us to, as a committee, to be looking at on a quarterly basis. Not necessarily in a formal meeting. And yeah, you don't need to do the hospital discharge ones. I've got a note of those from last week, and we'll be following that up. And I think that's it on recommendations. So thank you for doing that, Gareth. And then just the last couple of things are the forward work programme, which I think is taking good shape. If there's anything members would thinks that we should consider to put on the forward work programme, please let me know. From today, we've just reflected on the fact that in the future we want to look at direct payments as a working group, and also again, the preventative work that's going on in adults, again, I think we need to give consideration to whether that's a working group or at full committee. But I've got a note of that. And we've got in January coming up, we've got performance for quarter 3 and wellbeing assessments, and then we move on to budget scrutiny. So it's going to be a busy January. Can I please ask that if you can, you attend the pre-meetings that we have just before the before our full committee, because it really helps us sort of get organised with who's going to prioritize, who's going to lead with what area of questioning. So that's my plea from everyone else. And I think on that note, we can take the recording off being live and just have a just 1 or 2 minutes. I realise it's 8 minutes past, we're 8 minutes over. If we could just have a couple of minutes as a committee to reflect on how today's gone. But before we go off live, thank you to anyone who's watching this, and thank you again for members and your questioning. I think it's been a good session today.